Hey guys, my name is Stephanie Moran Luce, and today I'm going to be presenting to you my 2021 Genius Hour project. All right, let me just share my screen with you guys so you can see what I'm looking at. All right, so I did my project on ankylosing spondylitis. One second, just let it load. It came up on the wrong page. So funny story, I just recorded this whole thing and I was almost at the end and my computer died, which is really weird because normally when I get the warning, it gives me like 20-30 minutes and it was only like 5 minutes. So here we are redoing it, which is okay because I messed up on a couple of words, so we're going to work on that. All right, so my project was on ankylosing spondylitis. So what is ankylosing spondylitis? Ankylosing spondylitis is a rare type of arthritis that causes fusing of your spine. The word ankylosis means fusing of the bone or other hard tissue, and the word spondylitis means inflammation of the spinal bones or vertebrae. So cases of AS usually occur in short but very painful episodes. And some but not all cases can experience remission in between flares. So a flare is pretty much a period of time when your pain levels are super high, pretty much at the worst it can get. And then remission, all those pain levels lower themselves back to a low limit that is more tolerable. So that's kind of when your flares in your remission. Flares are all the way up here, remission is down here. Age and gender does not affect the severity of all AS cases. Some are just simply hereditary and can appear at almost any age. So a lot of people have some belief that men are more common to get this disease, but a lot of women have also got it, and there's not enough research to prove that more men have, or that men are more common to get this. And then AS is a lifelong or chronic disease with no definite cure. And then some causes of AS. So most cases appear in your teens and young adulthood. About 80% of causes start before the person turns 30, and 95% by age 45. So researchers are also not yet sure what triggers AS, but they believe genes play a huge role. So genes, someone with AS may have a positive HLA-B27 gene. It's more of a protein. Not everyone who carries this gene is AS positive, and not all AS positive genes, or not all AS positive patients carry the gene. So pretty much doctors believe that this gene tells your immune system to attack some common bacteria found in your body, which sets off all the AS symptoms. So your body is pretty much told to attack itself, which just kind of causes a whole bunch of other problems. And then as you can see over here in this top right corner, it shows progression over about 30-40 years of patient with AS. So starting in 1947, you can tell this male has a very straight posture, super good, standing nice and tall, knees are straight. Skip 10 years forward, 1957, the same male has, his knees have kind of bent down a little more, and his back is a little more sloped, and his shoulders are more slumped. So that's, you can kind of see that the fusion has progressed in that picture. And then another 10 years, so about 20 years from the start, 1967, his knees have extremely bent in, and his back is almost at a backward C shape. And he has now had to adapt to using a cane to help him walk. So that just kind of shows that the fusion has extremely become worse. And then skip forward a couple more years, 1972. This male is also still using the cane, so nothing has gotten better. His knees are more bent. His back is more curved. So clearly, as these years went through, the male patient experienced more fusion, and it worsened his posture and his mobility. All right, so some AS symptoms. Now, AS has a very wide range of symptoms, and not all people have the same symptoms. They can vary. But in early stages, it is normal for a loss of appetite, low-grade fevers, and some discomfort. The thing with the discomfort is that you can't, when you experience it, you can't pinpoint it or explain how it feels, which is a really weird feeling, but it's a common symptom in early stages. So AS symptoms also progress and they become more persistent. So in the early stages, it's not so bad. But then as you grow older, the disease itself progresses, which means that all of the symptoms as well progress and they become more persistent and occur more often. So pain in both sides of your back is normal, along with stiffness in the spine from fusing. And then as the fusing progresses, it's common to experience pain and tenderness in the ribs, neck, thighs, shoulder blades, hips, and sometimes in the bottom of your heel. So with ribs, I experience rib pain. I get swelling around my ribs and my lungs, so breathing is a little hard and my ribs feel kind of black and blue. My thighs get super tender. And then underneath my shoulder blades get super sore. My hips get super tight and stiff. And then sometimes when I walk, my heels hurt. It's not something I think you feel when you're laying down. It's more when there's pressure on your feet. And then with inflammation being such a large factor of AS, it is very common for you to be fatigued. And that's because when your body is inflamed, it pretty much throws all of its energy towards this inflammation to try and get it to go down. But your body only has so much energy. So when that inflammation overpowers your energy, you're going to be super tired and feeling like you're running on no sleep. And that's just biology, science. So then often iritis or swelling of the eyes is also a possible symptom, which can also cause blurry vision, pain, and sensitivity to light. So that's super fun, not being able to go outside without sunglasses or closing my eyes because it gives me such a bad headache. But you get used to it. Excuse me while I get a drink. All right, so some more AS symptoms. Poor posture, so your hunched shoulders, weight loss, anemia or low iron, worsened flexibility, difficulty breathing, and then heart, lung, and bowel damage. Spinal compression fractures are also common. All right, so even though there is no cure for AS, there have been research proven that various ways can help ease the pain, but not stop it altogether. So movement and exercise can help keep your muscles from stiffening, so that can cause you some pain if they start to stiffen. So it's pretty much just keep your muscles all stretched out. Yoga helps. Just normal stretching when you wake up before you go to bed. Changing your diet helps. A lot of foods have been proven to cause inflammation throughout the body. So foods such as starchy foods, sugary foods, processed foods, fatty foods, things all like that. Fish is a super good anti-inflammatory. Fruits, any natural, all organic meats, things like that. So things that are natural, no added chemicals, dyes, anything like that. And then maintaining a healthy weight is super important. If you gain an excess amount of weight, that automatically puts too much weight on your bones, and with AS you have weak bones, and it's dangerous because you can cause fractures, you can cause your knees to snap, and it's not very safe. NSAIDs have also proven to help simply just by easing pain and inflammation. And then in some severe cases, surgery may be an option if there is joint damage. So if you get a fracture from weight or fusing, things like that. And then alternative medicine can also temporarily relieve pain. So things like massage therapy, acupuncture, all those sorts of things can help relieve pain temporarily. So an overview of what we all just went over. Ankylosing spondylitis is a lifelong progressive disease, meaning it is chronic and will grow worse. There is no treatment to cure it currently, hoping that changes. Lifestyle changes, medications, alternative medicine, and exercise can help ease the pain and discomfort, but will not stop AS altogether. So in the bottom right corner, I have this picture shown. So the first picture is of a normal spine. You can tell there's no redness, no inflammation, and these blue things, these are your discs. So you can tell that the bones above and below are not connected at all. They're in the right place. And then in early stages of ankylosing spondylitis, the next picture, the redness kind of shows the inflammation and where it can occur. And then if you look at the corners of the upper vertebrae and the lower vertebrae, they're slowly starting to join together. And then in an advanced case of ankylosing spondylitis, inflammation has severely progressed, and then fusing is completely fused. Those vertebrae on the top and bottom have completely connected. So that's a severe case. And then some history. AS was first fully described by Bernard Conner in the late 1600s. Although there are skeletons with AS found in Egyptian mummies. There have been some AS cases found in other animals as well, such as cave bears, sheep, and oxen from ancient Egypt, monkeys found at the ancient temples of Thebes, and dinosaurs from the Mesozoic era and the Jurassic period. So Dr. Moody, a researcher in the 1930s, commented on these discoveries in her own words: apes, cattle, horses, the giant wolf, the sabre-toothed tiger, camels, Eocene mammals, crocodiles, and dinosaurs have all left evidence in their skeletons of ankylosing spondylitis, which in their lifetime, thousands of years ago, must surely have severely limited their movement and caused them a considerable amount of pain. So more history. First AS case published in medical literature had occurred in 1559 when Rildo Colombo, an assistant researcher at the UN of Padua, described two skeletons with spinal disease that suggested AS. So AS became a distinct disease later in the 19th century when Vladimir Bekhterev, sorry for my pronunciation, a Russian neurologist, based on a series of 3 patients, put forward the idea that chronic inflammation process of the vertebrae had led to rigidity, bone fusion, and myelopathy. So this is kind of when they started to think more about hereditary components and when they started thinking more about the HLA-B27 gene. Around the same time, German neurologist Strumpel and a French neurologist Mary had both described such cases as being primarily rheumatological. In addition, German pathologist Eugene Franklin gave the condition the name ankylosing spondylitis in 1904. So some interesting facts. Although a lot of people associate arthritis with old age, you think old people walking with canes, getting up saying, ouch, my back, my hip, things like that. Inflammatory arthritis tends to occur in earlier ages as well. With AS, about 80% of patients will experience first symptoms before 30 years of age, and a mere 5% will notice after 45 years. Most AS patients usually experience a significant delay between when they first experience symptoms and when they learn they have AS. So, according to a study in the Journal of Archives of Rheumatology, they found that an average delay was of 8 years. So with women, it is especially hard. Ankylosing spondylitis is kind of viewed as a men's disease. They believe that men can get it more than women. So when doctors look at a woman with these symptoms, they also project different symptoms in men. So when a doctor looks at a woman with different symptoms, they tend to kind of push them aside and tell them that they do not have it. And that's kind of when time progresses and you go on and on without a diagnosis. And it just takes a little while. Excuse me while I get a drink. Okay, so some areas of the body where inflammation can occur. I have this picture on the right if you prefer to look at that, but I also have them written out over here for you so that I can read them to you in case that you cannot see them. So your eyes have a 20% chance of inflammation, which is pretty rare. Your jaw has a 15% chance, which is also pretty rare. Your neck has a 75% chance, which is pretty common. Your shoulders have a 30% chance, which is kind of in between rare and common. It just depends on the person. Your ribs have a 20% chance, which is pretty rare. Your lumbosacral has a 50% chance. It's pretty common. Your hips have a 30% chance, which is, again, in between rare and common, depends on the person. Your wrists have a 5% chance, very rare. Your fingers as well have a 5% chance, also very rare. Your knees have a 20% chance of inflammation, which is also rare. Your heels have a 30% chance, which is in between rare and common. And then your toes have a 5% chance, which is very rare. And then how to treat someone with AS. So ankylosing is a rare disease and not like any other. So it is rare that you come upon someone with ankylosing spondylitis. But when you do, it's difficult to learn how to treat a friend or loved one. And it's not easy. So some things that you can do to help out. I'm going to read from this picture to the right if you'd like to read along. So to help someone, you can research ankylosing spondylitis, research their disease, symptoms, learn what they're going through. You may not be able to experience the pain, but you can know and you can be there to support them. Listen without judgment or offering a cure. Don't judge them when they say how bad they're in pain. Don't try to compare your pain, and don't try to tell them that their pain isn't as high as it seems or that they're being dramatic. And don't offer a cure. Mostly, it is most likely that all these patients have gone through multiple different ideas to try and ease the pain, but it's different for everyone, and some ideas may not work for others, and it just kind of upsets them when they've already tried that. So just try to not offer a cure and just listen without any judgment. And then if you have plans with someone with AS, do not be offended if they have to cancel at last minute or that they're not able to attend social events. And don't pressure them. A lot of times we go to bed feeling great and wake up feeling tired. It's hard to move and we just can't, we don't have the energy to go out. And you just have to kind of accept that. I mean, it is what it is. It takes a lot of patience to deal with someone with ankylosing spondylitis, but it means the world to them when you put the time and effort into caring. You cannot see AS. The person that you love may be in a lot of pain, but most of them do not show it. They normally have learned to mask it so that people do not see. And then anybody in a lot of pain is going to be grumpy. So don't get grumpy or mad at them back. Don't yell at them. Don't snap at them. If you're in a lot of pain, you get grumpy too. It's just more common for us. And then if you're close with AS, right now it's kind of hard with COVID, but ask to attend appointments for support and just to learn more from the doctors. And don't try to treat them like your patient. Don't try to push them from what the doctor says. So don't repeat the doctor's words and push them to do something. And then always remember to look after yourself too. You are just as important as anyone with AS. And AS can be hard on relationships, isolating, and overwhelming for all. So canceling on friends can be isolating, overwhelming, never knowing what's going to happen. So it's important to take care of yourself, but to put in the effort to care about your loved one with AS. And then these are just my resources. So I'm going to stop sharing my screen and talk a little bit about why I chose this for my Genius Hour project. Now, you may be thinking, Steph, you chose the easy way out. You took a 15-minute or 15-slide presentation on research from online. When I chose this idea, I did not look at it as if it was going to be something easy. That is not why I chose this. The past couple years, I've been dealing a lot with medical issues, and this was one of the biggest ones I just recently learned that I have a very high chance of having, and it's scary possibly having something that you have no idea about. So when I went into this Genius Hour project, I barely knew anything. I knew what it was, and I knew some of the symptoms that I had myself, but I didn't know any of the history. I didn't know any of the extra symptoms. I didn't know a lot of ways to ease it. And I got a lot of setbacks. I'm a person who procrastinates. And when you have 8 weeks to do a 15-slide presentation on research, you tend to want to push it aside. But I think the hardest part about procrastinating, my main factor, was that I would have days where I didn't feel well. And researching this was a constant reminder of what I had going on. And about midway, around like week 2 or 3, or around like 3 or 4, I kind of grasped the fact that this disease isn't going anywhere and it's stuck with me and there's no avoiding it. And that if I am going to live with it, I might as well embrace it and learn more about it and teach not just myself, but all of you guys out there watching this video today. And that was my main goal, was to teach myself about this disease so I could teach other people and be able to explain to them what I was going through. So therefore, for me, I didn't see this Genius Hour project as an easy 15-slide project. I saw this as a challenge, and I had a lot of setbacks with not having the motivation to do it. I didn't want to keep on looking at this disease that could possibly affect my entire life and change my hobbies, my lifestyle, my eating habits. I eat a lot of junk food, and I've kind of learned how to adapt to that. So this Genius Hour project has taught me an incredible amount of knowledge, not only medically, but about myself too. And for that, I'm thankful that we were pushed to do this project, and I look forward to doing it again next year, possibly, or maybe the year after. So until then, this was my 2021 Genius Hour project. Thank you.